Hey guys, welcome back to Who's at My Vanity, my show where I interview your favorite local creators and entrepreneurs. Today we have a very special guest, the beautiful, talented facial plastic surgeon, Dr. Julie Shtraks.
Hi, I'm Julie Shtraks. I'm a facial plastic surgeon in Bryn Mawr, PA, which is right outside of Philadelphia, and I'm super happy to be here.
I'm so excited to get into today's episode. I feel like I can't call you Julie.
Just call me Julie.
I know, I've been calling you Dr. Shtraks for
it's
months.
easier.
Today we're going over Julie's skincare favorites. She is a big fan of Elastin. These are all the products she brought today, actually. So while we go through these, we're gonna get to know her a little bit better. Gotta get started first with our small business shout out. So today,
I'd love to shout out Jet Set, which is a new Pilates studio in Graduate Hospital. And that was recently opened by a couple friends of mine, and I'm super excited to try it. They're opening another location in Haverford, which is closer to where I live, and it's amazing.
It's a really cute studio. I've actually been to the one in Graduate Hospital. So cute. If I lived a little bit closer, I'd probably go there all the time. I love the instructor, and the studio itself is so pretty. Do you do Pilates? Are you a Pilates princess?
Not yet. I struggle with working exercise into my routine. I'm always trying it, but I'm definitely ready to try it. So especially this one, because it sounds like it's amazing and the instructors are awesome. So I'll be trying it when they open in Haverford, which is a little closer to me.
We'll go to a class together.
Sounds
I'll make
good.
my way over there. Get you some grippy socks. Guys, I don't know if I said it in the intro, but Julie actually did my nose job, my primary septo rhinoplasty, and I get compliments on my nose all the time. I'm actually obsessed with it.
I love it. I'm so proud of it.
No, like, I'm so happy that I found Julie because I did my research for years, probably 5 years before I finally pulled the trigger and did it.
It's a really big decision, so I completely understand that. And I think I've been open online a little bit about my own rhinoplasty journey. I had one when I was a teenager, and I am currently looking to have a revision for various reasons. And so as I'm exploring, and I realize I'm a patient as well as a surgeon now, so I can really relate to that process. And so I'm glad you took your time. It's a really big decision, and I was happy to be your surgeon. It looks amazing.
Yes. I can only imagine what a different kind of experience it must be to have as much knowledge as you do about the procedure, and then all the network you have as well for all the people that you've met along your career.
So it's really interesting because once I shared that, I share with my patients all the time in the office, but once I shared it online, I got a lot of interest in what my process is going to be. And I think it's interesting because I think having the knowledge is a blessing and a curse a little bit. I know the people, I know the surgery, but it's going to be a little bit hard for me to give up the controls. So
Only you could do it on yourself.
Yeah. It'll be interesting. It's an interesting process I'm working my way through now, so.
And how do you feel like getting a rhinoplasty at such a young age? You got it done at 16. How do you feel like that influenced your outlook on facial plastics?
So it's interesting because I think at that time I was very young. I think 16 back then was a little different than 16 now. We didn't have social media. It was just a different time, and I don't think I was really aware of the impact it would have on my professional career, but personally it had a huge impact on my confidence. I really genuinely feel like it changed the trajectory of my life, which I know sounds like really dramatic, but it's true, especially as a 16-year-old. It was huge for me. And then I think as I made progress in figuring out what I wanted to do with my life, I could see that connection a little bit more. Why I was interested in the surgical arts, and I was able to connect my desire to be a surgeon with the impact that an aesthetic surgery can have on a person, because I experienced it myself. So.
And did you always want to go into medicine?
Like for a very long time. I was definitely a kid that was interested in science, like the biological sciences specifically, which sounds nerdy, but I always was. And when I went to college, I decided I wanted to be a physician. And then it just grew from there. As I got more experience, I knew I wanted to be a surgeon. And then that's when I was able to connect my desire to be in the art world and the surgery world. And so here I am.
It really is an art form. I feel like I learned a lot about that going through looking at different surgeons. You can see the trend on how similar each of their procedures has something a little in common, you know?
Yes. It's kind of one of those things where I personally believe that there are many good rhinoplasty surgeons out there. It's just, do you connect with their art, like with their vision of what they feel is beautiful? And so it doesn't mean that there's like one right or wrong answer. It's just like, I personally think that the before and afters is like an art gallery, and if you vibe with that art, then you're in the right place.
Yes, I looked at every single one of your before and afters and all of her socials. I said when she got here, I was like, I know everything about you from at least what you can see on social media, because I really did my deep dive. I was messaging people that she had done in the past too, and just being like, hey, random girl on the internet.
No, it's such a blessing to be able to have that now, because it absolutely did not exist when I was looking. And I mean, really, my parents looked for me, and you really have like so many resources at your fingertips now to be able to figure these things out and make these huge decisions. And so I encourage people to really do that deep dive. It's a big decision.
I'm glad I did. I
Looks so
really
good.
love it. I couldn't stop looking at it. We got sidetracked. First thing in Julie's routine is this cleanser. We're obviously not going to wash her face right now, but we're going to get into the second product, which is her vitamin C.
So I use the vitamin C in the morning, and I love this product. A vitamin C is an important component in any skincare routine. I use it in the morning. I especially like Elastin's products just because they feel really good on your skin. This one is C Radical Defense. So this is your antioxidant. It is neutralizing free radicals that our skin is exposed to in the environment, so UV, pollution, etc. So it's protecting, and it is also collagen producing, so important component.
I love that. I've been trying to work on the skin on my neck actually. Randomly, I've noticed that I have these really deep tech neck lines, and I bought myself a posture corrector immediately because what do you mean? I'm 26.
So this is like the hardest thing, and what people say in skincare is never neglect the neck, but it's hard. You have to bring all your skincare down onto your neck. You know,
working on it.
Doesn't get better with age. Truly, they call it tech neck because these are almost sleep lines. Botox has no value for these horizontal ones. So
work on that posture.
Preventative.
As my boyfriend says, you're so beautiful when you sit up straight.
I personally cannot, but if you can sleep on your back, you're
gonna have to
just
soon.
gold. I know. I know.
I had a setup on the couch, and I was just like wedged into the corner with a big pillow on my side, and
that I think is the hardest part. I think for me that would be the hardest part.
So we've talked when we were going over my procedure about how much technology has changed since you got your first rhinoplasty to now. What do you think are the biggest differences?
So I think it's a mixture of new technology and also just a better understanding of the nose as it ages and as post-rhinoplasty noses age. So from a technological standpoint, I think probably the biggest thing is powered instruments in the nose, like the piezo, which is something that I use. It's a tool that basically you can use to make the reduction of bony bumps and making cuts in the bone. It makes it kind of smoother and less downtime, less bruising and swelling, etc. I personally think the biggest advance in rhinoplasty surgery is the understanding of how the changes that we're making in the nose are going to age over time. There's a lot of talk now online about how will a rhinoplasty look in 10 years, and I think back then it was like, how can we make it look as good as possible right away, as in 1 week later? And that was a lot of reduction, cutting things away without reestablishing structural stability. And we don't do that anymore. So you can rest assured that your nose will stand the test of time, because we use grafts now, and we are just aware of the way that the nose will change if we don't support it. So
there's so much more that goes into it, obviously, than you would imagine. I feel like when I went into my first consult, my question, I was like, well, will you have to break my nose? And that's how I realized how little I knew. They were like, girl, there's so many more things that we're going to do to your nose, and there's micro fractures, right? So it's so funny because I get that question a lot. I think patients think that it's more serious if you have to break the bones, but I break the bones in 99% of the rhinoplasties that I perform, so it doesn't make it more serious. It's just an important part of rhinoplasty. And we are breaking the bones. It's not microfractures per se, but we're doing it very carefully and meticulously, so it's not traumatizing your nose like in the wild. Everybody was shocked about how little bruising I had. I think I had like a tiny little bruise here, and it looked like I had blush on or something. My patients really don't bruise that much. It can happen. Bruising is super variable and unique to each patient. When you told me that. But they really don't bruise a lot. And you would say it's because of the new technology that you implement? So bruising, I think there's a couple of things, and this might be a little niche for people, but not only is it the way that I'm breaking the bones, but it is a special medication that I put topically in my fracture sites that decreases bruising. It's something that I started doing probably like 4 years ago, and it made a massive difference. And so the recovery was amazing, and she doesn't pack the nose. I loved that because
Yeah.
that was one of the scariest things I feel like I was worried about.
I feel like that's a game changer for patients too, because probably the hardest part of recovering from rhinoplasty is not being able to breathe through your nose. And it just makes people feel almost like panicked if they can't breathe out of their nose. And so not packing is a great way to ease that part of the recovery.
I tell people it was honestly not as bad as some of my worst hangovers. Really not bad at all.
It's a great comparison.
I know. And I don't want to talk just about rhinoplasty because
Sure.
I think it's just a small fraction of all the procedures that you do. Say it's your favorite.
Well, rhinoplasty is my favorite, but I do all procedures of the face and neck, so I also really like eyelid surgery. I think that can be hugely transformative, and it's actually really easy for patients to recover from. And then I do things like lip lifts, face neck lift, laser, the whole gamut.
That is a lot. So is there such thing as a mini facelift?
So I get this question about mini lifts all the time because people are hoping that I will say that they can have a mini lift. So a mini lift is a marketing term. It is not a technical term. So I think that's a really important distinction because there's a million facelift names out there and it's hard for patients to kind of navigate what they're looking for. So marketing terms like mini lift don't actually describe what the surgeon's doing. It's just suggesting that something is being done in a mini way. So whether that's a small incision or a small lift, but my feeling is that mini lifts yield many results and people aren't happy with them for long. So I think it's much more important to be looking for the technical terms, and that's like probably getting in the weeds for this, but deep plane versus SMAS, those are more technical terms that actually describe what's being done, and that is much more important than a marketing term. Truly, a mini lift just makes patients feel better about getting a face.
Yeah.
That's the honest truth.
And then they end up getting another mini facelift.
So the next product that I'm obsessed with is Alastin's Illuminate Brightening Serum. And I use this every day, twice a day. I personally love this because it works by calming down your melanin producing cells so that you're not getting the sun damage as much. The dark spots, exactly. So it kind of calms those cells down so that they're not remaking sun damage. And I love it. It's honestly probably the skincare product that has changed my skin the most.
Oh, nice.
Yeah, it all feels good on your skin.
So what would you say marks the difference between a great surgeon and just a good plastic surgeon?
So that's a great question. So I think there's a couple things. I think you can talk about it more from like a personal sense and then from a professional sense. So I think professionally, a great surgeon is always striving to be better. So I think you want a surgeon who wants to master whatever it is that they're doing, and mastery of aesthetic surgery is always a moving target. You should always be working on improving, getting better, be critical of your own results and want to do better. So I think that that's super important. And you can tell that about a surgeon. You can tell if they are really proud of the results, if they care deeply about the surgery itself. And then I think on the other side, on the more personal side, you really want to find a surgeon who is listening to you and really cares about like delivering a good result to the patient. So like there's that distinction between wanting the good result for your patient, which is super important, and caring about that deeply, and also wanting personally to love the results. So I think you should have both, and that makes a great surgeon.
And I had done multiple consults, and something that really stuck out to me when I saw you was how willing you were to look at my Photoshops. I've talked about this before on my channel. I made, poor Julie, because now I'm sure anybody who's talked to me is gonna present her this PowerPoint. I made her like a 10-page PowerPoint, just kind of explaining what I do and don't like and trying to find a way to describe what I was going for, and she was so willing to look it over and talk to me about it and did not make me feel like I was annoying, because I had gone to consults before where they were like, don't want to see the Photoshop, it's not realistic.
So we've talked about this, and I talk with patients about this a lot. I have no problem getting that type of information. In fact, I think it's like super helpful. So if someone shows me a PowerPoint of things that they like and those examples are consistent, then it just shows me what they find aesthetically pleasing. And again, my goal is for patients to be happy. That is the ultimate goal. I care about that a lot. So if that is the easiest way to describe what it is that you're going for, then for me, like that, just more information is really good. I have honest conversations with my patients about realistic expectations, so I'm not intimidated by a PowerPoint. I actually like it. I think it's helpful. So
I'm gonna actually put some clips of it here because It was a little intense, but it made me feel so confident going into it because I knew you understood what I liked. And
that's your opportunity to like, to say all that you want to say, you know?
I think I wrote in there specifically, I was like, I know natural is subjective, so I don't care if it looks like I've had work done, because I'm like, not so natural, not too much.
Well, I think that's like a very fine line, right? People want to look natural. You want to look like you could have been born with your nose, which I think is the case for you, but you want to look like there's enough of a difference so that you feel like it's worth your while and it addresses your issues. So I think it's a fine line. You have to strike the balance. So I think we got there.
I think that also gets into our next question about what you would say are some red flags when patients come in. Have you ever told a patient you won't do a surgery?
Yes, I have. I would say biggest, and this, I'm speaking specifically about rhinoplasty because I think rhinoplasty can be incredibly emotional for patients, and I completely understand that. But I think one is if they clearly, to me, don't have realistic expectations and I don't feel like I can deliver what they're looking for, that's one. And two is if they are seeing something that I don't see. So a lot of times, people that find these very, very, like the minutia, the very tiny asymmetries, I worry about that because I have to be able to see it to improve it. And if I don't really see it all that well, then I certainly don't feel comfortable. And also, rhinoplasty is an imperfect surgery. Your nose is pretty close to perfect, but that being said, it is an imperfect surgery. I'm super honest about that. So if asymmetry is already so tiny, then it's not a good idea to pursue an imperfect surgery on a patient like that. So I try to, that's hard for me actually, like to say no. It's like something that I think like a learned skill as a surgeon, because like I hate disappointing people, but I would rather disappoint someone before I operate on them than after.
And you set the expectations very clear. I just love my nose.
We got close to perfect here.
It's literally so good.
Very proud of it. And that's like what I mean also when I talk about that aspect of being a good surgeon, hopefully. I mean, I consider myself someone that is striving to be better all the time, and I feel really proud of my results, and that's one of my favorite things. I think people a lot of times they want to know, why do you want to be a facial plastic surgeon? What made you want to do it? And of course, I love giving people the confidence. I love, like, you know, making changes in people's lives. Of course, that is like goes without saying, but I really also enjoy what I'm doing when I'm doing it. And I feel really proud of my work. I feel like it's also art.
I was so on the anesthesia, but my mom was like, she said it came out really good.
No, so when I come out and I talk to family and I'm like, oh my God.
She was
like that's how you know.
It came out great. I was like, say less. I'm still in anesthesia. You already had the before and after from the table sent to my phone. I was like,
I mean, when your surgeon comes out and is so excited, that is truly the mark of, you should feel good about that, so.
Something I wanted to do forever, and I'm excited for you to get your revision.
Too. I'm excited and I'm nervous, and I think that's hard for people to understand because I do this for other people, but I'm still like a person as well, and I don't take this lightly. Like, I don't take it lightly for my patients, and I don't take it lightly for myself. I know that there's like risk involved. I'm used to my face. I know a lot, and I still, of course, I think the benefits outweigh the risks in my situation, and I'm doing it thoughtfully and carefully, but I do feel like I've had this nose for a long time, and it's gonna be, I don't know, potentially challenging. I'm trying to prepare myself for that, to see myself differently for a while. I prepare my patients for it, but it's like a whole other thing when you're doing it yourself, so.
Yeah.
But it's gotta be done, so.
Getting that nose cast off, I was like, Mom, shut the camera off.
I try to prepare people for that. I'm like, you know, it's not, like, people get that side profile view on these videos on Instagram, and it's not always like that right away.
Swallowing is no joke.
It is no joke. And even in the first couple weeks, it gets so much better, but it's not always love at first sight, so.
I swear every day it looks cuter. So I know you did your fellowship in Beverly Hills and actually had some experience working with the cast of Botched.
Yes.
And the team there. So what was that like? Give us the tea.
It was crazy. And that was the busiest, craziest, most exciting year. I had just had my first daughter, so I moved from Philadelphia to Beverly Hills. I lived in Beverly Hills with my husband and my daughter, who was 6 months old at the time, and started my fellowship there. And it was just like a wild experience. I worked with Dr. Nassif, who a lot of people know from Botched, and he like remains a mentor of mine, and we stay in touch. He's a really great person and I learned a ton from him. He's not the only person that I worked with out there though. I worked with him and another mentor, his name is Babak Azizadeh. He's a fantastic facial rejuvenation and facial paralysis surgeon. And then another surgeon named Guy Massey who's world renowned for oculoplastic. So the year was like unbelievable in terms of like my exposure, the people I learned from. I truly am a phone call away from like the best surgeons in the world. So it's really amazing. It was an amazing experience, but I worked so hard. Like, so hard.
With your like infant baby.
With my infant baby. And you know, that's just part of being a woman in surgery, that you just have to get through it. And I did, but it was really tough and I would not have been able to do it without my husband. He really picked up the slack that year.
Yeah. What is it like being a mom and having this career?
Now, you know, it's always hard to strike the right balance, but it's much easier now that I'm not in training than, you know, when I was. But I wouldn't change it for anything. I like when young women who are going into the medical field like ask me for advice, the main thing I tell them is do not delay your life, your family planning for medicine. It will always be there. You have to do what's right for you at the time that's right. And I'm really glad that I made those choices for my family.
You're Daddy.
So.
She did it both, and she has the two cutest daughters ever.
They're
so cute.
They're adorable. They keep me really busy. They're kind of wild girls, but they're spunky and cool and funny, and I love them so much. And I try to like strike the balance as best I can. I really feel like you can have it all, but you can't have it all at once all the time. So I feel like when I started thinking about it in that way, I felt better about like I'm failing at certain things at any given time. So I just think showing up for your family when they need you the most is the most important. And sometimes you're gonna feel like you're not doing the best at everything all at once. Yeah, but I'm doing my best and I know my girls feel loved and I spend a lot of time with them. And I think I also dedicate a lot of time to my patients and my career. And so it's a hard balance, but.
We were talking about this before we got on camera. Guess where she met her husband?
So I met my husband at Ladder 15, where all happy couples meet. And yeah, so we met one night and we were dating ever since, and the rest is history. And now we've been married for almost 10 years. So.
Oh, congratulations.
Thank you.
You have such a cute family.
Thanks.
What's the next product?
The next product is Elastin's Restorative Skin Complex, and I use this one twice a day also. This product basically clears out old, damaged skin cells and makes room for new collagen and elastin production. So I love that one. It also feels really good on your skin, and that's a twice a day one. The one thing that I missed because I didn't bring it is my Retinol, which is a nighttime product, but should shout that out because I do think that that's an incredibly important part of a skincare routine. The two main skincare ingredients that are tried and true evidence-based are vitamin C and antioxidants and retinol.
See, I feel like I should be using retinol.
You should.
And I get sent it all the time and I'm so scared to implement it in my routine for some reason.
So if it's a medical grade retinol and not like a prescription strength, it's gonna be lighter on your skin, and you can start by using it every other night or just twice a week, see how your skin responds, and then you can increase it to every night over time. Some people get dry from it, so you can moisturize before, you can moisturize after, you can do both. That's like the most evidence-based skincare product.
And it's so funny how I give away all these amazing retinols that I get sent because I'm scared to use them because I feel like I've figured out exactly what my skin likes. I'm scared to change my regimen, but I should.
You can just really gradually work it into your regimen.
And all over the face other than the under eyes?
No eyelids, otherwise you can use it everywhere.
Cool. So next, let's get into social media. Do you feel like social media filters, TikTok, Instagram, these things have changed how we view plastic surgery and experiences you have with people who come in?
Yes, I mean, without a doubt, social media has made a huge impact on how young women and men see themselves and what their expectations are. I think social media is a big blessing, but also a curse in some ways because it creates some unrealistic expectations of beauty, and people are able to filter or curate what they share, and then young impressionable people are seeing it on the internet and comparing themselves constantly. So certainly the community is good because a lot of people are sharing honestly, and so you can relate to people, and like Destiny is definitely one of those people. And I think TikTok is actually like one of the more honest platforms in terms of like people sharing the good, the bad, and the ugly. Whereas Instagram is a little bit more curated in my experience. So it's tough. I see it in both ways, but I personally think that this younger generation is really, everybody's online. Pictures are being taken at all angles. And I think we're seeing ourselves way more often and in way more angles than we were when I was a teenager. And so it sort of like breeds some confidence issues. And I see a lot of patients who want to do things really young. And so I'm having more and more conversations with young people about kind of holding off on some of these facial rejuvenation things. You have your whole life to do some of these more permanent treatments. And so it's a balance.
You ever used Face App? Or do you know about the app, Face App?
No, what is that?
It's just the craziest editing. Let me show you. Oh, let's take a picture of you.
Oh my God, I would love to see what I can do. That's not me at all.
I wouldn't be surprised if people were coming in showing you before and after.
Oh, you know what? I love that. That one's subtle.
You too.
I like it a lot.
Like the volume.
Is this a paid app?
Yeah. The volume, you can like make your hair thicker and more voluminous.
Oh my God, I
know it's so bad.
I love that. No, but I wouldn't know. I honestly wouldn't know if
another
people were posting like
fallen
that.
to Face App. Now I got totally on it.
It's nice. I like it.
It's
certainly easier than like, you know, some of the more permanent things you can do to yourself. But I think that we're all a little hard on ourselves these days.
I agree. Feel like I can't imagine having been younger in these developmental years having TikTok.
No, it's so hard. When I was growing up, when I was a teenager, it was like disposable cameras or like digital cameras, but not phone cameras. And Facebook wasn't a thing until I was in college. I had to have a college email to get a Facebook account.
Really?
Yeah, that was like the first thing I did when I got into college was make a Facebook account. And Instagram, when I first had Instagram, I thought it was like a photo editing app. So for I don't know how long, I had the same picture of me and my friends and all the different
colors
filters publicly accessible. I didn't know that it was a photo sharing app for the longest time. It just was such a different world. And I actually feel really lucky that I grew up in that time. But I think now it's just, we just have to be careful about striving for perfection. And I think this is true for the young generation, but also for people who are a little bit older. I'm a true believer that I'd rather show some signs of aging than look weird or altered or too much. And like, that's just my personal style as a facial plastic surgeon and an injector. I'd rather accept the little signs of aging than distort someone's face into like something unrecognizable.
Some people look like clay.
Yeah, we're not clay though, you know? So we should just
when are you gonna let your daughters, you think, be on the internet?
Oh God, I want to keep them white as long as possible, honestly. I think that there's a movement by moms like that are around my age to like keep our kids off of the internet for as long as possible, or at least like social media as long as possible. The pendulum is swinging in the other direction a little bit to try to
that's comforting to know.
So hopefully by the time you have kids, we'll course correct a little bit.
Literally, because it's just actually so crazy to imagine. Wait, so this is...
The last product is eye cream. I use Elastin's Restorative Eye Complex every night.
How much?
And just important note, an eye cream is not a substitute for like eyelid surgery, something that I see patients all the time that are like, I bought so many eye creams and like, why do I still have like these bags? This is just gonna improve your skin texture. It doesn't volumize, it doesn't get rid of your bags. I personally feel like skincare is a critical thing to do. It is an important part of just like maintenance of your skin health. But I also don't rely on skincare as the sole way that I keep my skin looking good and smooth and healthy. I think as you age, it's gonna take more than skincare. Doing things like microneedling or light lasers or peels that will help resurface your skin and keep it looking glowing and youthful. So
do you see the ads for products that basically just look like they disappear the bags on your eye? How does that even work?
So if you go like this, if you tighten your skin, it will temporarily look like your bags are gone, but that's incredibly temporary, and it's just basically a camouflage of what's underneath. So there is no treatment for eye bags besides removing them.
So that's the upper bluff?
So the upper bluff is like the incisions on the upper eyelid, and that's just removing this type of excess skin. The lower bluff is like a combination of removing bags, so like puffiness, and then restoring volume here in this little tear trough area.
So where's the scar for this?
On the inside of the eyelid.
Oh.
For the lowers.
Oh my gosh. Wait, up here?
No. So for this one, the scar's in your actual crease. So with your eye open, you don't see it. And then with the lowers, it's like on this part of your eye, not to be gross, but on the inside.
That's so interesting. Do you like doing that procedure?
I love that procedure. I love that procedure. I feel like that is the most high impact facial rejuvenation procedure you can do for someone. And it's like really easy to recover from. Yeah.
Just sounds scary.
It sounds scary because it's like in the neighborhood of your eye, but I always tell people, yes, I'm close to your eye, but it's in surgical terms, I'm like a million miles away.
Yeah,
it's like really a million layers between me and your eye. So it's just like hard for patients to wrap their brains around, but it's one of my favorite things to do.
I think I've seen you post a video about getting that at the same time.
I'll do eyelids at the same time as rhinoplasty. One thing that I'm not sure if I've shared about this, but like I don't necessarily love the idea of doing like a facelift and a rhinoplasty at the same time. Or sometimes people will come to me and they'll say, I want to talk about my eyelids, my face and neck, and my nose. And I am just a believer that like a rhinoplasty is like a big enough procedure that it requires, that should be the biggest thing you're doing. If I'm pairing rhinoplasty and upper eyelids or lower eyelids, the rhinoplasty is still the longest procedure. It shouldn't be an afterthought. I am not a believer that like you should be doing 7 hours of facial rejuvenation surgery and then like tacking on a rhinoplasty. I just think the rhinoplasty is a main event in its own.
How long does, what is it, neck lift or like
so a face and neck lift, and you've experienced this, obviously different surgery, but whenever you're quoting somebody for a time, it's not just the time of your surgery. You need to go to sleep and wake up and all of that. So when I'm booking someone for a face and neck lift, I book it for 5 hours, but that's including the 30 to 45 minutes of going to sleep, marking, numbing, all that stuff, and then waking up. And so then when you're adding things like eyelid surgery, you add a couple of hours for upper lower, and then you're like kind of getting close to like 7 hours. So then to put on a rhinoplasty after something like that is one, it's a really long time under anesthesia.
It's a lot for you too.
And two, like so I think about things from the surgeon perspective and a patient perspective because I'm a woman, and I feel like these are all things that I'm thinking about too, eventually for myself. Would I want my surgeon working for 12 hours on my? The answer is probably no. I want someone to focus on my nose, and then I will come back for the rest, you know, when the time is right. That's how I feel, so.
I miss that anesthesia. That was honestly the best nap I've ever taken in my life.
Sometimes I'm a little jealous.
No, like, usually you'll have to enough. I remember I woke up though from it, and they were like, get up and out, because I knew I was like, if I laid back down, I'd be toast.
People are like snoozing after that.
Oh my god, that's
hours, so.
That's so crazy. I don't even remember getting back home. But guess what I did do? Make TikToks in the car. They're so delirious and crazy.
Did you post them or are they in the draft?
Oh my god, they're so like, bloody all over, and I have that whatever that like, yellowish.
Oh my god, betadine?
Yeah, I have like some of that on my neck. I'm like, oh my god. And so 2 more questions for you. Who's your inspiration? Who inspires you?
So I would say that I'm inspired mostly by women who are able to balance professional success, personal success, whether that's like personal relationships or kids, and then a social life, because I think all 3 of those things are critically important to who I am as a person. So I really look up to other women who I feel like can strike a really good balance with all 3 of those things.
The Holy Trinity.
It's really tough. So I think there's a lot of people who can do 2, but doing all 3 is really hard. And I would say I have a couple friends who are other amazing female facial plastic surgeons who really inspire me. One is actually my co-fellow. Her name is Dr. Erin Smith. She's a facial plastic surgeon in Austin, Texas. And from the day I met her, she inspired me. She has 3 girls and did all of that during training and also manages to keep a really active social life. So I really just like, I'm inspired by being around her and some of our other colleagues who are just doing it all.
Powerhouse plastic surgeon with girlfriends that likes to go out, and then the family balance.
So I really like, I strive to be able to hit all 3 of those things, and there are a couple of women out there that are doing that really well, and they don't have to just be surgeons, just any woman that is able to achieve their professional accomplishments and balance their personal lives, I think is just so cool.
I think that you inspire me a lot with that because I can see you're doing the same thing.
Thank you.
So what would you say, this will be our last question, what is something you're proud of that has nothing to do with your work?
That's an easy one for me, and that's my 2 girls. So I have 2 daughters, one is 7 and one is 4.5, and I'm so proud of them. They're just like the most fun, spunky, cool girls, and they keep me really busy. They keep me on my toes, but I'm super proud of them, and they're the best thing I ever did, and I just love watching them grow. And I just hope I'm a good example for them. So.
Of course. Also my dream, I hope I have 2 girls.
The best sisters are the best.
I know.
Nothing like that bond, so.
Love my sister. Shout out Vanessa if you watched this far.
And Stacy, my sister.
Is there anything else you want to chat about?
No, this was great. I feel
Right?
like we
This
hit
is
all the
fun.
high points.
This
So
is
thank
gonna
you for
be a
having
longer
me.
one, for sure, of course. Thank you so much, Dr. Julie Shtraks, for joining me on my episode. I cannot believe she's sitting in my apartment right now. When I started the show, you're actually one of the people that was on my list of dream guests on my dream guests on my podcast.
This was so much fun. Thank you for having me.
Make sure you follow Dr. Shtraks on TikTok and Instagram. She's always posting. She has a lot of creative ideas on there and talks about different kinds of procedures that I didn't even know existed. So a lot of fun. Thank you for coming on. And of course, stay tuned. We have so many exciting guests coming on to Who's at My Vanity. Talk to you next time. Bye guys. Oh my God.